Hi everybody, Michelle Lyons with you here, and I'm here today to tell you all about my new course, Female Pelvic Oncology Rehab. I've been teaching courses on oncology rehab all over the world for the past decade, and this Female Pelvic Oncology course is a combination of the Gynae Oncology course that I've taught live, as well as bladder and bowel cancer rehab as well. So we're really going to cover everything that's happening cancer-wise in the female pelvis. It's been material that I'm very passionate about, and unfortunately I feel a lot of women with pelvic cancers have been underserved really over the past number of years. And it's a peculiar situation because we have a lot of research showing that rehab works, but we don't have a similar level of awareness or confidence in pelvic rehab or women's health practitioners. What we want to do is we want to bring together the best of research with practical skills to help women live well during and after cancer treatment. So what are we going to be covering in this course? Well, here's a little overview of some of the things we'll be covering in the course. First of all, what cancers will we be covering? Essentially, cancers that affect the female pelvis. So from a gynae perspective, we're going to go through vulvar, vaginal, cervical, uterine and ovarian cancers. We are going to talk about bladder cancer, which is surprisingly common, as we'll talk about in the course, and bowel cancer. Does this affect many women? Well, according to data from the American Cancer Society, 23% of all newly diagnosed cancers in women are going to affect either gynae system or the bladder or the bowel. Now, a further 26% of all women with a newly diagnosed cancer will have breast cancer. And you know that's a topic I'm very passionate about as well. So that means that 49% of newly diagnosed cancers in women will have implications not only for pelvic health, but for global female health. We also know that treatment's improving. So that means that women are living longer after treatment ends. And we want to make sure that not only are they enjoying a better quantity of life, but we're also giving them a better quality of life. What if women have pre-existing pelvic health issues, but before their cancer treatment starts? Is that something that we need to be aware of? We're aware of the great success of prospective surveillance in breast cancer survivors for lymphatic management. Is the same thing happening for pelvic health for women with pelvic oncologies? No, would be the short answer. So can we help? Absolutely. By doing this course, I think you'll have a strong toolbox to help women live well. What are some of the treatments that women are going through? Well, we've got surgical treatment, obviously. We've got local excisions, we've got vulvectomies, hysterectomies, pelvic exenterations, and dealing with ostomies, I think, is a topic that's not talked about often enough, because we really do want to be aware of managing intra-abdominal pressure for these women and teaching them how to exercise safely, because as you may have heard me say, exercise really is the best medicine during and after cancer treatment in terms of decreasing the side effects of cancer treatment, but also reducing the risk of recurrence. Lots of women will also have radiation, and we need to understand the effects of radiation locally on the tissues, particularly in terms of progressive fibrosis in the pelvis and the abdomen, but also what are the direct effects on the bladder and the bowel? What do we need to know about progressive fibrosis and scar tissue? What do we need to know about bone health and lymphedema after pelvic radiation? If a woman's going through surgically induced menopause, what does that mean in terms of brain, bone and heart health, and what can we do to help her? With pelvic or genital or lower extremity lymphedema, would you recognize the signs and symptoms that somebody's lymphatic system is coming under stress? Would you be able to help her? We want to think about how scar tissue, general mobility, breath movement, bowel function, all of these things are going to affect a compromised lymphatic system as well. Ultimately, what I want to do is I want to give you confidence about the etiology of pelvic cancers, about the treatment options that women will be going through medically and surgically, but then to give you a really strong rehab toolbox using manual therapy, taping, exercise prescription, lifestyle advice, stress management, all of the gaps that can sometimes be left after conventional medical treatment ends. I want to help you take women from asking, why me? Isn't it greedy to ask for more? Aren't I just lucky to be alive? Because there's a huge amount of research showing that a lot of women have survivor guilt after gynae cancer particularly. And I want you to take a woman who may be talking about that from a survivor guilt perspective, from asking, isn't it greedy to want more? I want you to empower the women that you're working with to ask, why should I have to suffer if help is available? The Female Pelvic Oncology course is going to be a perfect complement to the Breast Cancer Rehab course. And together, these two courses are really going to give you, I hope, the tools, the clarity and the confidence that you need to help women live well during and after cancer treatment. I hope you'll be joining me. Stay tuned for a launch date. And if you have any questions, let me know underneath. Bye for now. Thanks for watching.